guys. Sorry my video is a day late. It's been kind of a crazy week, and I've had like tons of meetings and trainings, and it's been kind of crazy. Anyways, I was reading through the summary that we got for the habits for the highly effective people. Um, the first one here that we have is being proactive. Um, as far as I go, I can say I'm pretty proactive when it comes to certain things. I guess it just kind of depends on what it is. And some things I am not so proactive on. We're probably all a little bit like that. But for the most part, I'd say I'm um, pretty proactive. I try to kind of stay in control of what's going on in my life, and I try to be pretty optimistic and positive. And I feel like I'm in pretty good control of my life, but there's still always improvements, things that I can work on. And the second habit, beginning with the end in mind. Yeah, that's really good. Um, I've always tried to kind of focus on the bigger picture of things. And I don't know, I've always kind of like had end goals. I'm very like goal oriented. So yeah, I tend to do that a lot. For example, when I bought my new car, it's been a couple years almost. I think I've had it. I wanted to buy kind of a family car and make sure that there were room for car seats in the back. And it's kind of weird to think about when you're like 21 or whatever. But I knew I'd have this car for a while. So there are like certain things I try to kind of like plan out ahead, think of the bigger picture. I was kind of thinking about my new position that I have at work. I'm a medical policy analyst, so I'm writing medical policies and reviewing old policies, and kind of researching like the newest drugs and therapies and things that they're coming out with. And I have to kind of interact with our medical directors a lot of the time. And we had a big meeting last Tuesday with all the medical directors, and we were actually kind of reviewing a couple of cases to see. It's called an iterator meeting. So we're reviewing. They pick a couple of cases, and then we review them to see um, exactly what happened and if they agreed with what happened. There's a bunch of like there's a nurse panel, and it's kind of like a quality of care thing. But one of the doctors said when you get someone in the hospital, you want to start planning for their discharge on day one. As soon as they get there, you don't want to, just work on their discharge like the last day they're there. You want to, that's your end goal. And so that kind of reminded me of that. It was a good concept to have, like plan for discharge on day one. And I think you can apply that to some other things in your life. It's kind of creepy reading about being at your own funeral. Um, but yeah, I think I'm pretty good at doing that. I set out a lot of goals. I set out like resolutions and things like that, certain things that I want to work on um, personally, and I think I do a pretty good job at that. Okay, so then the next thing is, sorry, I'm blind, so I'm squinting. Um, Summarizing the precede proceed phases 1 and 2 that I worked on. So mine is kind of a little bit different. I'm trying to focus on those with the low socioeconomic status and their access to quality health care, since that's kind of what I'm working with now in my job. Um, yes, So I'm not exactly sure that I did it right because I don't really have like a specific disease that I'm working on. So I don't really have like the numbers and everything for that. I'm still trying to figure it out and narrow down exactly what I want to do. And have it somewhat related to my field work that I'm working on right now. Um, that has to do with like our Quest members, which is our Medicaid and Medicare members. So I'm trying to figure out how to kind of use that same population, I guess, but I'll be working on a little bit of a different project. Yeah, so as we discussed in Lindell's class with our social determinants of health class, socioeconomic status is definitely a huge disparity, and it affects a lot of people around the whole world. But in Hawaii, there's certain areas, especially, that are more affected by it. Let's see here. So I kind of just discussed what the problem is, just saying that SES has been identified as a health disparity. Why do we care about this problem? It can be used to predict behavior, among many other things. It does disproportionately affect minorities and those residing in certain areas, kind of like I discussed earlier. And it can greatly impact one's well-being and overall quality of life. So it's very important, I feel, to address it. And what is the desired end result? So I put that the desired end result is to develop a program that will help prevent or reduce this disparity by educating the affected community as well as enabling and encouraging them to make healthy behavior changes. How will the desired outcome improve health and well-being? So I just said that it will contribute to a lower prevalence of communicable and non-communicable diseases among children and adults in Hawaii, which will ensure a higher quality of life and overall sense of well-being in the target community, allowing them to live happier and healthier lives. So for the second part, phase 2, that's kind of the part that I was struggling with a little bit. So I just put for my health topic, access to quality health care as preventative medicine. So who is affected? I kind of listed that target population. And then I noted that some ethnicities, I know like Micronesians and Native Hawaiians in particular, have a higher risk of certain diseases. And people of all ages can be affected by this. And I also noted that access to healthcare impacts one's overall physical, social, and mental health status and quality of life. So I listed some barriers to health services, which include the high cost of care, inadequate or no insurance coverage, lack of availability of services, lack of culturally competent care. And then these barriers to accessing health services can lead to unmet health needs, delays in receiving appropriate care, inability to get preventative services, financial burdens, and preventable hospitalizations. Does it disproportionately affect a certain population? Yes. I put those in low-income areas are at greater risk of certain diseases due to the lack of availability and access to healthy foods, access to quality health care, education, and also fitness centers. That plays a big role in it too. Are safe areas to kind of be active. Those residing in rural or non-metropolitan communities are also more likely to lack access to supermarkets carrying fresh and healthy foods at an affordable price. So I kind of was driving, I go to the west side a lot, go to the beaches over there to dive, and I kind of noticed as I was driving through, they really don't have very many supermarkets. There's a lot of like 7-Elevens and like convenience stores. And also there's like every single kind of fast food place you can think of. I was just driving down the street and I was like, oh, McDonald's, Taco Bell, Jack in the Box, like they were all lined up, and it's crazy to me. I was like, and we were having a big barbecue too, and I was like, where do you go to get vegetables? You know, we were doing like burgers or something, and I was like, there's couldn't really find a lot of places with fresh and healthy foods. So that was definitely kind of sparked my attention and kind of helped inspire this project a little bit. Let's see what else. Why is it an important topic for target population and stakeholders? So obviously, the target population would benefit because it can program could like these could prevent diseases, or they can detect diseases in their early stages. Preventative medicine can also be very beneficial to the stakeholders, such as like the government or the state, who is actually paying for a lot of these people's care, because it's going to save them a lot of money if it's like a primary prevention, doing things to ensure you don't get sick costs a lot less than treating diseases and when you do get sick. It's a lot cheaper to get someone a flu shot than it is to have them get a really bad strain of the flu and end up in the hospital and things like that. So it would save them a lot of money in the long run. I kind of just put diet, exercise, lifestyle, and also your attitude towards health kind of makes up for the behavioral analysis for this part. Social environment, the family and peers, community attitudes, gender roles, race and ethnicity, workplace, things like that play a role. The economic environment definitely plays a big role in this. Availability of jobs, affordable housing, health insurance, purchasing power, things like that. Genetic predisposition, race and ethnicity, gene study, parents' health, things like that all play a role on your overall health. So yeah, it's kind of the outline that I have for now. I know it's not complete. I need a little bit of direction, or I need to kind of fine tune some things and figure out, I could think, kind of just zone in on exactly what it is that I want to focus on for this program. But that's what I have so far. I hope I didn't bore you guys too much. Sorry, I know it's like 13 minutes, super long, sorry. But anyways, I hope you guys have a good week, and I will talk to you guys later.